So today we're joined by Simon Blake, CEO of Mental Health First Aid England. Thank you for joining us, Simon.
Pleasure.
We all know the important role that the workplace can play in supporting the mental health of people, and that's never been so important as it is now. Today we're specifically going to talk about the role that mental health first aiders can play in supporting the mental health of people. So we're going to talk to Simon about this. Simon, firstly, how are you?
I'm okay, thank you. I mean, I think like all of us, still trying to process what's going on and new information coming through. I'm an outdoors person, so being indoors is taking a bit of adapting, but yeah, doing okay, thank you. I hope you are too.
Yes, I am. I'm well in challenging circumstances. What role do you think that mental health first aiders can play in supporting the mental health of people in the workplace at the moment? And sorry, firstly, just how many, do you know roughly how many mental health first aiders, I know the number's constantly going up, but how many mental health first aiders are there in workplaces in the country at the moment?
Well, what we do know is that we've got mental health first aiders in about 20,000 workplaces, and in the last 3 years have trained about 150,000 mental health first aiders. But that's the people we've trained. Whether people then go on to use that training, but about 150,000 people in about 20,000 workplaces is sort of gives you a sort of sense of the quantum.
Okay, so there's a number of people out there who will be hopefully ready and able to support. And what role do you think that they could play today, especially for those people who are remote working?
Yeah, I mean, what we know, and we've been talking to lots of mental health first aiders, is that it seems to be sort of 3 categories really. The first is making sure that they're getting as much information out to people who are working remotely to ensure that they know the ways to keep themselves healthy. And I know you at CMHA have produced some guidance on that, as have we and as others. So one role that mental health first aiders are playing is making sure that that information, that advice is reaching people in the workplaces. The second then is that mental health first aiders are also setting up sort of virtual drop-ins. So they come in and have a chat type space, either on an individual basis or also in groups. And some mental health first aiders within organisations also taking responsibility for some of the social connecting and the more fun aspects that seem to be developing within organisations as we all adapt to Zoom and to Teams and various things. So people saying, actually, we're going to do the things we know will help to keep people better. And then, of course, there is the piece which is doing the role of mental health first aider, as is traditionally known and understood within the workplace, but making sure that's able to be done remotely. So ensuring that they are available to people, even though they may be working from home.
Okay, great. That's brilliant. One question that's come to us is for furloughed workers who are maybe not getting that day-to-day contact that potentially a remote worker might get. Is there a role that mental health first aiders can play for them?
Sure. I mean, and I guess, the key thing about furloughed workers, of course, is that they still have all of their employment rights. And so there is nothing to stop organisations enabling people who are furloughed to access, mental health first aiders. I think that it's probably about the communication. So that's the one side, ensuring that people who are furloughed have got access, ensuring that they know that the employee assistance programme is still open to them, mental health first aid support and any other support in the workplace is still open. But also, of course, we know that furloughed workers can volunteer. Now, if you have furloughed workers who are mental health first aiders, whether that's volunteering at a very community level, whether that's within the NHS or whether that's within other charities and organisations. One of the things which I've spoken to some people who have been furloughed already, and some of them have been advised, use the time to do what you can, and that's been part of the conversation that's been had, and for others that hasn't been part of the conversation. So I think it's just up to all of us to start making sure that everybody knows the opportunities, the possibilities, and are thinking, how do I use my skills and my experience and my commitment to mental health to do what I can in my workplace, in my community, or within wider society. The one thing I would just also add, if I could, is that we have we've updated our guidance for mental health first aiders to say how to help to do that when people are working remotely. It was one of the things that very quickly became obvious that we needed to do. So that is now available on our website, which is updated guidance for the mental health first aider about how to apply their skills when working remotely.
Okay, thank you. That sounds really useful. We'll share that link as well widely. And that's an interesting point you said about furloughed workers who are mental health first aiders, about how they can use their skills, because as we know, giving is one of the ways to well-being. Final point is, it's a challenging time for everyone, including mental health first aiders, and obviously in playing this support role, it may be, while they want to do it, it may also be a stress on them. Do you have advice for how organisations can support the mental health first aiders themselves?
I mean, it's a really, really important point, isn't it? That you can only be a support to somebody else if you're well enough yourself, whether you're physically well enough and mentally well enough. And of course, we know that some of the people who put themselves forward for mental health first aid, are empaths, people who really want to provide support to others. So we have been really clear that if you are a mental health first aider, you need to really make sure that you're thinking about your own self-care, and you need to think about your own boundaries. And of course, anything that anybody within organisations who's supporting mental health first aiders, who's connecting to them, needs to keep on reminding of that. We've written a blog actually, which is from our Director of People, which again, I can make sure you've got the link to, which is about ensuring the principle of self-care, looking after yourself and being well enough to deliver this. And of course, in uncertain and challenging times, we may be well enough on Monday, but not on Tuesday, and then feel okay, fairly shortly afterwards. So we do just need to really urge all mental health first aiders to keep checking in with themselves and keep making sure they're well enough to do the job. Yeah,
that's a really important point. Final question, Simon, is obviously you're a training organisation. I've been to one of your courses and I found it so helpful, but clearly it's difficult to do the training in person at the time. Are you starting to offer some of your courses virtually?
Yes, so we are delivering already the half-day awareness courses and the half-day refresher course, and we're also currently looking at how we can take our other courses into virtual classroom spaces and trying to do that at pace. So there's more information on mhfaengland.org, which says what is available now, and also we will be making sure that we keep lots of information going out about what is coming in the coming weeks. Brilliant.
Simon, that was really helpful. Thank you very much for your time, and thank you for sharing your insight. And we'll be sharing this widely. Take care and good luck, and stay well.
Thank you, and you.
Take care.